Thank you, Ernest and Gaza Media, for giving us this opportunity to talk a little bit about the Health and Wellness Committee of LECUDO.
Dr. Hilary, you are welcome to Gaza Media. So, as you've known, we have been following up the activity of LECUDO USA, trying to see exactly what they are doing in relationship to those back in the BLM, precisely in Lebanon. We understood that you are the chairperson of the Health Committee. What are your specific role as the chairperson of that committee?
Thank you, Ernest and Gaza Media, for giving us this opportunity to talk a little bit about the Health and Wellness Committee of LECUDO. I'm actually a co-chair with Dr. Tumbang Nyonsembeng, and our role is basically to coordinate our meetings, set the agenda, and report to the executive and the BOT, and ultimately to the conventions and the General Assembly. And so over the last few months, we've had a number of meetings beginning in April this year. We've had monthly meetings to discuss what we consider are important things for our brothers and sisters, both here in the US and back in Cameroon.
Yes, okay, thank you. Somebody did mention to my ear, and we want to confirm from you that one of the objectives was to set up probably some health unit in Lebanon, since many people have been displaced due to the current war going on there. Is that true?
Yeah, our agenda included a number of different things that we discussed at the beginning that we thought would make sense to our people. One of them involved providing improving access to care to people back in Cameroon. And there are two aspects to that. One of them is really not really to start new health centers, but to rehabilitate existing health centers. And there were a lot of them in Lebanon. And at the beginning, we can't really tackle all of them. Our goal is really to start with a few of them, strategically distributed in the Lebanon Fundum. We've been considering different areas, including in Genecha, one in, I believe, in Bindia, one in Nguyen area, and the other one around, I believe, in Bindia area as well. The hope being that those people who live closer to Mary Health of Africa, which is still currently open, may go there for healthcare needs. And we're hoping that those who can't really get there can get access to minimal healthcare through health centers. They may not be fully open, but at least somebody will be available to provide emergency care when needed.
Okay, yeah, let me follow up with this question. I think you mentioned about 3 to 4 of these health units that want to rehabilitate. I know sometimes it will relate to finances. How much budget are you looking at, or specifically, what do you really want to put in place that can immediately start benefiting those that are internally displaced or those that are living probably in the very remote or in the bushes?
So the ask that we've made of LECUDO executive is about $5,000. And our plan is to use this money to acquire some essential medications that can be safely kept at Mary Health of Africa, and consignment taken as needed to various destinations to help take care of our people. As a matter of fact, we really don't know how much it would cost, but we believe that that minimum amount may be enough to help us get started, buy essential medications to take care of wounds, and then they will be used as needed, and they will not be exhausted until all what we have spent has been used. But there are still logistic issues that we have to deal with to actually get this operational. One of that is the security situation back in our fundum. The other aspect for our budget really has to do with trying to mobilize our brothers and sisters who are in the healthcare field in Cameroon to go out and provide some basic screening, say for hypertension and diabetes, in areas where people have been displaced, like Chang, for example. And also to provide, and to do that, we'll need a little bit of support from our brothers and sisters abroad to provide transportation and accommodation for those who are willing to sacrifice some time to provide these services for free to the bank sons and daughters who are displaced, starting with Manual Division.
You stated that you will probably need a minimum of 5,000 to start with. So if the bank people that are listening to you right now, here, particularly here in the US, what will you tell them that in terms of continuity to continue sponsoring this project, what message will you have for them?
The basic message is that ultimately, all the previously existing health centers will be open when the security situation improves. But for a beginning, we're targeting just about 5. And the goal is that if a woman were pregnant, they could still have access to safe delivery. If somebody got wounded in the farm, in the forest, while they are fleeing from war, they should be able to have somebody to attend to them, to attend to their wounds on an emergency basis. If they came down with malaria, typhoid, as they are commonly reported in Cameroon, they should have somebody who can take care of it. Or if a child is suffering from dehydration due to diarrhea, somebody should be able to treat those closer to where they live. Now, our hope is that as we begin this process, we will be able to provide statistics in subsequent conventions. One of the interesting ones, which I mentioned earlier, would be an easy one to measure and report quickly. And that relates to the mass screening for hypertension and diabetes. So if we screen 1,000 people who are displaced in Chang, we may be able to come back and report that we found that X number had hypertension and diabetes, and they are now on treatment thanks to the efforts of our people. So that is the way that it would be evaluated as time goes on.
Dr. Aroke, Hilary, thank you so much for your time. We'll continue to follow you up as the activity unfolds, and we would like to have some feedback even after the convention as you continue with this project. We thank you for tuning in today. Dr. Aroke, yeah, sometimes people have complained, especially people here in the US, that sometimes it seems like a LECUDO leadership is more focused on the people in Africa than sometimes forgetting about the people who are actually living here in the US. And if you look into some data, you also see that there are some elderly parents that are also living here in the US. What is the health committee? Are you not considering those people too as well?
Yes, indeed we are. And we are looking at a number of different initiatives, which I would touch briefly on, with the hope that we will elaborate on some of this during the convention. The first is that is to improve access to healthcare to our brothers and sisters living in the United States. And how do we intend to do that? The Health Committee has launched a Liban Health Professionals Network. And the goal of this network is to bring all healthcare workers from Liban who are working in the United States into a common forum. And once we come together, we'll create a database whereby if somebody required healthcare and they didn't have insurance, at least there will be somebody in the state where they live who can attend to them in one way or another. The other aspect to this healthcare professionals network is to really improve networking among healthcare professionals, mentoring and helping people to advance in their career, and also post important job openings where, especially when people are planning to move from one job to another, so that will be very easy. Provide a forum where people can provide easy referrals and references for people seeking new positions. That is one aspect. The second one is that we intend to improve health education, basically. The Health Committee plans to launch monthly health talks where we would pick different aspects of health education and just talk to our people what it means, how to take care of themselves, and so on and so forth. The last aspect is really during each convention, we intend to do a little bit more outreach and actually provide free screening. One of the things that we're planning to do for this particular upcoming convention is one, to set up a booth where we can provide free screening for high blood pressure and diabetes, for example. In that light, we are calling on all healthcare professionals living in the United States who intend to come to the convention to come with a blood pressure apparatus and glucometers that can be used to measure blood sugar, that some of which will ultimately send them to Cameroon, including the lancets and the glucose sticks and the sticks that are used. We are also hoping that there's also some talk about trying to see if we can come out with some free donations like Fitbits to help motivate people who want to continue to exercise. All of this will be available during the convention essentially on first come, first basis, because we won't be able to have enough for everybody. But we are really going to put health and awareness on the forefront of some of the things that we discuss by setting up a booth and trying to reach out to our brothers and sisters living in the US and telling them that we are here to help them.
Yes, Dr. Okay, let's go to a specific time. I always bring this up because time is one of the key factors that will always run out. The convention will run from Friday evening, I believe, from around 4 p.m. and Saturday, the 31st, the entire day probably. So which day will you be actually doing the screening?
The screening would be done on the day of the convention.
Okay, on the Saturday.
Correct. It's concurrent. The goal is not to, it doesn't take 2 minutes to take your blood pressure. It doesn't take 2 minutes to check your blood sugar. And that's all what we need to do. So you can stop by the booth, you get your blood pressure taken, and you'll be told. If it is normal, you'll be advised by a healthcare professional that your blood pressure is within normal range. If it is high, we'll ask you to follow up with your healthcare provider. If you have high blood sugar, which a screening test can help with, we'll ask you to do a follow-up if needed.
And you are saying that this screening is totally free of charge?
It would be entirely free of charge. And it also, the availability would also depend on the availability of the healthcare professional that we are calling to show up and help with this process. We do not have people who have already signed up to volunteer. This is a special appeal we are making to all healthcare providers in the United States who intend to be at the convention to provide supplies and to provide their time to screen our brothers and sisters who are willing to take advantage of this opportunity.
Thank you, Dr. Aroke. I think that's a wonderful initiative. Dear viewers, if you are a nurse from the bank and you are listening to Dr. Aroke, please come on the 31st with your stethoscope and your blood pressure manometer to actually help in this screening process. Yeah, before I will let you go, I know you mentioned about telemedicine. This is something that is a little bit new to most of our folks. And you also indicate that if somebody is staying somewhere and maybe don't have insurance, especially most of our elderly people that they come here, probably they cannot have insurance because they are not able to work, and those that have not been fully documented. So this message may actually be directing to them. What were you saying specifically?
What we're saying is that the Health and Wellness Committee is trying to organize itself by identifying those who work in the healthcare field, whether you are an LPN, an RN, a BSN, a nurse practitioner, a physician assistant, a medical doctor, a pharmacist, a social worker, a physical therapist, a speech therapist, whatever you do in healthcare, we are going to need you. And the only way we can use your services is if we know where you live, so that if one of our brothers and sisters needs your help, you will be connected to that person and you can provide help at a very low cost. For free, essentially. The goal is to provide this for free. Also, for those who may need just basic advice, like a healthcare coach, there will be people in the network who you can call and ask for advice. I went to my doctor and they said I have diabetes. What does it mean for me in terms of our diet, given what we eat from our place? What should I eat? What should I not eat? If even physicians who are well trained in Western medicine here in the United States may not necessarily understand that fufu has a lot of calories. And if you tell them you eat fufu, they have no idea what you're talking about. You need somebody who knows your diet, what you eat, and what it means for your health. You need somebody who can tell you that you need to exercise a little bit more. The goal is to make sure that our brothers and sisters, especially our elderly mothers and parents and fathers who are here, have at least some basic health care when needed.
Yeah, thank you so much. I think that will be a wonderful project to benefit LECUDO members and the bank people here in the United States. I believe this is something that they have been launching for a very long time, and it seems to be a breaking point. Again, I want to thank you so much for tuning in today. Is there any last word that you might want to offer before I let you go?
Well, the last word is that it takes a village to build this kind of initiative that we are launching. The healthcare committee itself is composed of just about 10 people whom I would very much love to at least acknowledge their names if it were possible. And I had a long list here, and that would include Dr. Amijo Bikong, Dr. Bernard Mbebo, Christella Mbebo, Dr. Edmund Folefag, Dr. Ekorobe Fonkem, Dr. George Alemji, Dr. Primo Sabila, Dr. Yvonne Fomenga, Dr. Fonjia Fonguni, and Therese Abila, who is our liaison with the executive, not forgetting Dr. Ntumbang Nyonsembeng, who is a co-chair. These are people who are working, but this is just a tip of the iceberg. Our goal is to harness the talents of all the bank sons and daughters in the entire United States to provide assistance to our people. So it's a joint effort. We are just here to tap into those talents and redistribute so that we can all benefit from it. We'll start off by elaborating on some of these topics that we've talked on at the convention, provide some screening as much as we can, and then hopefully, and we hope that people will tune in the coming months to our monthly health talks, which will deal with different aspects of how you can take care of yourself, because health education is so important. If you don't know what you need, you won't go out to look for it. We'll start by educating our people about what it means and what you need to do to stay healthy in the United States. Thank you.
Yeah, thank you so much. That is wonderful. Please, that was Dr. Aroke. Yeah, giving a blueprint of what the health committee wants to do to the bank people, particularly here in the United States. Please stay tuned to our Gaza media and continue to follow us. I will bring you more community and development news. Again, good evening and bye-bye for now.